Hello, and welcome to Wealth Health. My name is Terry Dean, and for the next 15 minutes, we're going to be discussing the health of your wealth and financial security, primarily for employees and professionals in the healthcare industry. With me today are Tom Jarris and Sean Shadwell, certified financial planners and partners with the Premier Financial Group. Tom, let's start off by learning a little bit about yourself and why you chose to specialize in the healthcare industry for financial planning.
Hey Terry, thanks for the intro. And again, to introduce myself, my name is Tom Jarris. I am a certified financial planner or CFP professional with Premier Planning Group. As Terry mentioned, our firm is located in Cincinnati, Ohio, and we are an independent office, which means that we do not work for any individual investment or insurance provider. We say that we work for our clients and do what's in their best interest with a provider that makes sense for them given their situation. I've been in the industry for about 10 years now, and I started my career at a large retirement plan provider working with people in the healthcare community. And one of the things that I found out, Terry, was a lot of people in healthcare have very specific job functions. They are very specialized in what they do. And a lot of times their benefits do not reflect that. And furthermore, a lot of people are looking for help and they do not know where to turn and they do not get that service provided to them through their employer and really don't know where to turn. So that's really what sparked our interest in working with people in the healthcare community.
And Sean, how about yourself?
So along with Tom and I are partners here at Premier Planning Group. I've also been in the business a little over 10 years. Tom and I met at that retirement planning company and where we created our relationship. I also am a certified financial planner, so CFP professional. And what I would add to what Tom said is when it comes to healthcare and that community, we've become really passionate for it. It's a very large percent of our clients. So, in that regard, we have become specialists when it comes to analyzing their group benefits at these large hospital conglomerates and really providing detailed, specialized instructions on how to make sure they have appropriate coverage to go with what their companies provide.
I'm sure a lot of people that are watching this are more concerned about taking care of their patients than taking care of their financial planning. Uh, and most people have group coverage. Is that not good enough?
Yeah, that's a good question. And I think the big thing, Terry, is the devil's in the details with your group coverage. So I'll give you an example. I have a client who's a nurse at a hospital here in Cincinnati. She makes about $100,000 a year when you factor in her salary and her overtime. And she has a young family, she's in her mid 30s, married, et cetera. And she was really concerned about if something happens to her and she cannot perform, the physical nature of her job, if she cannot do that, what's going to happen to her? So I looked at her benefits. She was under the impression that she would get 60% of her income if something happens to her. Well, in her case, she actually gets 50%, but it's only 50% of her salary. So her income is, say, $100,000, of which about 40% of that comes from overtime. So instead of getting, say, $60,000 a year if something happened to her, she's really only getting $30,000, right? 50% of her $60,000 salary. So a lot of it is devils in the details, and it doesn't cover what people generally think it should cover. And part of that is when you go to enroll in your benefits, everything is very high level. On a lot of logins that people have, it'll say, life insurance, 1x your salary, or disability in that example, 60% of salary. But it doesn't actually specify the details of the policy.
Yeah, and I
Sean,
would like,
I'm sorry,
oh,
go ahead.
I was going to say, Terry, I'll just add to that a little different side of that story is we actually had a surgeon client, right? So very specialized in operating room on a regular basis. And he came down with a condition where his hands, because of the cold environment, basically would lock up. So he couldn't hold a scalpel, he couldn't perform surgery. Well, based off his group policy, he could be a variety of other doctors, but he couldn't be a surgeon. And of course, he supplemented with his own policy that had the appropriate language that said, hey, if I can't be a surgeon, then I get a payout. Not that I can go be a family doctor, not that I could go teach, that I can't be a surgeon, then I can get a payout. Whereas his group plan didn't have that verbiage in it. So he would not have been paid in that case with his employer coverage.
Many policies as part of the group plan have insurance coverage, a life insurance rider in their group benefits. That is probably a term life insurance policy. What is the difference? You hear term life insurance and whole life. Which is the difference, and which would be preferable?
Yeah, good question, Terry. So with group coverage, you're exactly right. It is a term policy, and typically the way that it works is as long as you're employed and they either give you the benefit or you sign up for it, you're going to have some sort of coverage. Generally speaking, when you leave the employer, you will lose that benefit. A lot of group plans do not have what's called portability, meaning that you can take it with you, obviously. Taking that a step further, the main difference is when you hear whole life versus term. Whole life is what's called a permanent life insurance product, which means that it's with you permanently as long as you pay, right? So that's pretty simple. The the main difference is permanent life insurance is much more expensive because the insurer is expecting to pay out that claim at some point in time. There are some other bells and whistles that go along with it, and you can use it for a multitude of reasons. I would say that generally speaking, neither one is preferable. For a lot of our younger clients who are in healthcare starting out, who might have student loan payments, young families, things like that, we typically say, hey, go with term. It's less expensive. It gives you the coverage that you need. If we have someone who's maybe more established in their career, who is doing a bunch of different retirement savings, maxing out the various vehicles available to them, maybe we'll look at a permanent product to help supplement that.
So, Sean, is there anything that you might like to add as far as the life insurance coverage?
Yes, Tom made some really good points. He talked about portability and being able to take coverage if you leave an employer to your next employer, or to be able to take it with you if there's a gap before you find a new employer. Because as we know, a lot of times when you join that new hospital or that new organization, there's a lag before your benefits kick in. So if you've lost your coverage and you have a lag before your new coverage and something happens, you're in trouble. And I actually have a client experience where he was shopping around, looking at leaving his employer, thinking about maybe going out on his own to do something different instead of working for a big conglomerate. And so while we were discussing his current benefits at the large hospital he was in, where he had group coverage, I said, we should look at supplementing something outside. That way, if you do leave, you do something different, you have coverage, because his insurance was not portable. He could not take it with him. So we get him underwritten, get him taken care of. He's married, couple kids, so it was perfect. In the interim of him leaving his employer and looking at his next employer, he came down with COVID, and he had a really bad, young guy, early 40s, but he had a bad side effect to it that affected his heart. And now he has AFib and would be unable to be underwritten for a couple years after having COVID and developing AFib. He was in the hospital for weeks. So he ended up making it. He did not die. So that's super important in the story. But he did give his coverage ahead of time. Had something happened, his family would have been taken care of.
I'm hearing a theme is that while the coverage provided is good as part of the group plan, in many cases it's not going to be adequate. So the recommendation would be that if somebody is interested to learn more about how they can expand or really fulfill their entire coverage that they need, how would they get in touch with you guys?
Yeah, so Terry, I think the easiest way is if you go to our website, which you obviously are on, then there should be a form filled there. If you fill it out, we'll get an email with your info. We'll reach out. No obligation. Obviously, there's no cost for a consultation. Everything's complimentary. But we do this all the time, where we review benefits that are provided to people. figure out what's going on in their lives and situation, and make recommendations accordingly, and go from there.
Sean, anything you'd like to add to that?
No, I think that's perfect. Again, Tom and I, like he said, we on the front end always do our consultations complimentary, figure out what the need is, and see if we're a right opportunity to help fill that need.
Well, Tom, Sean, thank you for this time today. And I believe in our next session, we'll be taking a closer look at wealth planning for the future, primarily as it relates to people in the healthcare industry. Again, thank you for your time.
Yeah, thank you, Terry. And that's absolutely right. For our next one, we have it planned where 403Bs that a lot of local hospitals offer have a really unique feature that we're going to talk about that not many people are aware of. So we think it's a really big opportunity for plan participants, and look forward to sharing that with everyone.
I'm Terry Dean, your host. Thank you for joining us for Wealth Health.